Hello everyone, I'm Dr. Sakamoto. I will talk about a cervical disc herniation patient in his 70s and his stem cell therapy. This patient had numbness in both hands and legs for 10 years, and the condition gradually worsened. He felt strong pain in his legs even when walking. He also had diabetes and peripheral artery disease in the legs. The cause of the numbness in his legs could be, first, diabetes, second, cervical disc herniation, third, lumbar disc herniation, fourth, peripheral artery disease in the legs. These can make the legs numb. In this case, the numbness in the legs was not necessarily due to cervical disc herniation. Besides the numbness, he also had difficulties flexing his elbow due to weakened muscles in his upper arms, as well as a weakened iliopsoas muscle, which is important for walking easily. When we look at the symptoms of these four diseases, diabetes, cervical disc herniation, lumbar disc herniation, and peripheral artery disease in the legs, only cervical disc herniation and lumbar disc herniation weaken the muscle. We can then nail it down to only these two. The MRI results in the neck and the lower back showed no damage around the spinal cord in the lower back. But the spinal cord in the neck appeared to be pressured, and herniated discs were also found. Because of these test results, he had surgery for cervical disc herniation. His surgery was for herniated discs in the cervical spine, and the level of numbness was reduced a bit, especially the legs showed improvement. However, it did not improve his walking ability. This is his MRI image after the surgery for cervical disc herniation. If you look closer, the white part shows as a damaged spot on the spinal cord. Once you have a herniated disc for a long time and the spinal cord is pressured, even if surgery removes the bulged parts, the spinal cord can possibly remain injured and leave aftereffects. This patient still had the complication of numbness in his hands and legs and weakened muscles. His biggest complaint was that weakened iliopsoas muscle made it difficult to walk more than 200 meters. At our clinic, he received stem cell therapy to the spinal cord. This patient received 2 injections of 25 million stem cells each. The stem cells injected into the spinal cord migrated directly to the damaged spot in the neck. As a result, in 2 months, the strong numbness in his hands was greatly improved and remained only in the thumbs. Strong numbness in the right leg reduced by half. The most difficult part, the weakened iliopsoas muscle, returned to normal, and he could walk for long distances without tiredness. The strength of his biceps were also back to normal. Conventional surgeries for the herniated discs can sometimes cure the numbness in the hands and legs and weakened muscles, but most cases leave some aftereffects, where some numbness remains and muscle strength does not come back. When I was working at the hospital, I told the patients that after surgery of a herniated disc in the cervical spine or lumbar spine, the numbness and weakened muscles may remain. That was how I explained it to them. It means that nerves often cannot heal completely. For example, cervical disc herniation can cause strong numbness in the hands, which does not improve much with medicine, and it can make it hard to sleep and difficult to maintain a regular lifestyle. I often heard these kinds of complaints. These patients decided to have surgery on the neck for the strong numbness, but it could not be relieved at all. For these cases, there's nothing more we can do under the current Japanese healthcare system. Like this case just explained, the after effects of the surgery to the herniated discs on the neck, such as numbness and weakened muscle, could be healed only by injecting stem cells into the spinal cord. The numbness and pain was improved, the muscle strength returned to near normal. I was very amazed. Like this case, for the patients who suffer after effects remaining even after surgery for the herniated discs in the neck and lower back, I believe the stem cell therapy is the best medical treatment. For people with a herniated disc on the neck and lower back experiencing after effects on the spinal cord, numbness, and weakened muscles, I think that spinal cord stem cell therapy can be the most promising treatment. We talked about stem cell therapy to relieve after effects after surgery for cervical disc herniation. Thank you for watching.